there. How we doing today? Yeah, well, it's not ideal to be here at the wound care center, but see what we can do to take care of you, make you more comfortable, okay? All right. Okay, I just need you, obviously, the usual question you answer a million times, but we have to be careful and all. Okay, can you confirm first and last name and your date of birth for me? Okay, okay, okay. Okay, okay. I see that the nurse checked your blood pressure. I don't see temperature. Okay, let me double check that. Let me double check that. Okay, 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 okay. Not too bad, but a little high there. Okay, let me go over some of the things. What brings you in today? Okay, and that was from a surgery. That was an incision. Okay, 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 okay. Well, before we take a look at things, let's just kind of go over the basics. What meds do you take on? Okay, and that's daily. Okay, 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 they got that. Mm-hmm. And okay, and what's that for? All right, all right. Okay, and what health conditions do you have? Okay, okay. Mm-hmm. And when was that diagnosed? Okay, 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 okay. We gotcha. Okay. Are you a smoker? Never. Well, good to hear. Do you drink? How often? Oh, okay. Okay, how's your diet with the healing? Because you know that's important. Okay, okay, okay. Lots of fruits and veggies? Lots of protein? Yeah, actually you do need because protein is really good for healing. So, if you can get that, obviously lower fat, but get that in there. Are you getting any exercise? I know it's a little difficult with what's going on. Okay, mainly walking. Okay, okay. Oh, okay. Yeah, can't overdo it, obviously, because yeah, we gotta be careful. Do you have any allergies? Okay. Oh, then that's okay. Yeah, that shouldn't be a problem. That shouldn't be a problem. Okay. Okay. Well, let's take a look and see about what's going on here. I'll just carefully peel before we do the gloves, just so I can, you know, okay. I don't want to contaminate. Okay, see how we're doing here. Okay. Okay. Yeah, it's not too bad. I mean, obviously, we'll talk about bandaging and things like that, but a little bit of serous fluid. I do see it's slightly green. Have you had any symptoms that would okay. Ah, okay, you've noticed that. Mhm. A little trouble sleeping too? Okay, well, I mean, it's not surprising at all, but, we wanna that's the other thing is that healing sleep is one of the best things. Yeah. Yeah, I understand it's pretty tough right now. It's been going on a while too, hasn't it? That's why it came to us. Yeah, well, we'll see what we can do. Okay, I do have to okay, let me see here. Okay. Okay, let's see what we got here. Okay, let me got things clean. Get into the old nitty gritty here. All right. Okay. Okay, before I'm gonna put some gauze with some lidocaine on it to numb. Before we do that, I'm gonna go ahead and measure over top, see how we're doing width, see how we're doing height, that kind of thing. Once things are numbed up a little bit, then we will check and see how we are going for depth. Make sure that there isn't any little channels going on. We'll do that. Okay, so let me, not the inches. Thank goodness we're not measuring in inches. You're doing good there. Okay. Okay, let's take a look here. Okay. Okay, did you note that? Okay, thank you. Okay. Okay. Okay, so fortunately not too gigantic, but still, we'd like it to be gone altogether, wouldn't we? Okay, now let me. Hmm, things that are better to do without gloves, but then you're not sterile. Okay, let me get that. Some of that. Okay. Okay, we'll get that laying on there for a while. Okay. Okay, well, it'll just take a few moments to, it's topical, so it's not gonna be any issue. Let's take a few minutes. I'll go over a few more things with you. When was your date of your surgery again? A while ago. Okay. Okay. And currently, are you having any pain, discomfort? Could you rank that 1 to 10? Okay, not too bad, but and what kind of pain is it? Is it more of an ache? Is it okay? Oh, okay. Okay. Yeah. 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 Yeah, that is another reason we'll go ahead. What we'll go ahead and do is I'll go ahead and when I'm checking for depth and things like that, we'll take the swab and I'm going to send that out, get that cultured and make sure we don't have a bacterial infection of any kind. And if we do, then we'll talk about any additional, okay, you had them right after surgery, but that was a while ago, the antibiotics. Yeah, but if we have a need for them, I know the good kind because that's my job. Yeah, we'll make sure. Okay, okay, okay. I think we're good to go ahead and start doing some depth testing here. Okay. The good kind. And just don't, if you ever get any of these, don't think about sticking these too far in your ear either. Okay, let's check the depth on your thing. I'll be as gentle as I can. Let me know if you're having any pain, any sharpness, but it should be pretty well numbed right now. Okay. Okay, a little bit of tunneling on this side. Okay, and I see one thing I do notice when I took off the bandage, you do have a little bit of inflammation on the outside. Is it's staying a little moist? Okay, then I'll make sure that we cover that part with the bandage so that, yeah, so that we're good. Yeah, yeah. Okay. We do see some granulation. That's a good thing. I mean, the red isn't always necessarily bad because then it means it is still ripe for healing. That is good. Okay. Okay. Well, here's the process that we're going to need to do. We're not doing too bad. I'm glad you weren't doing too bad there. We're going to need to pack the wound because fortunately it's not deep enough that we would have to worry about going back in and doing any sort of surgical close-up at the moment. However, it is deep enough that without packing it, that it's not going to heal properly. It will definitely heal improperly. You would have a area underneath there that would be open area. It'd be subject to more infections, and we don't want that. But since you've been going through this a while, and since there is a possibility that you might have like a lingering infection, what we're going to do when it comes to packing it, we're going to use something. Let me the bottle here. It is what's called Dakin solution. And let me tell you a little bit about this. It's really interesting. This is actually old school, old school. This was actually something that was developed during World War I. Yeah, really. Hey, sometimes the old school solutions are the best. What it actually is, it is a very diluted combination of, yes, bleach, actual bleach, and baking soda. And you're not going to feel it. Though we do need to be careful to not get it on anything that you're wearing. Mm-hmm. Yeah, it can. Just like bleach, it can. Yeah. But we'll do, pour a little bit of this and okay. Okay. Then let me get some gauze. Right. Right. Okay. I think, yeah, that should be good. Okay. Cut that off. We'll get that soaking in the Dakins for a little bit. Okay. Okay. Excellent, excellent. Okay, now let's prep before we start doing that. Betadine. Get around the area. Yeah, you remember that from childhood, huh? Ooh. Well, let's get that swabbed. Okay. Okay. Swab that good. Make sure we got sterile feel. Okay. Okay. Right. Now, I'm going to go ahead. Okay. Make sure squeeze that out. Okay. Okay. Now we're going to start packing the wound. This is another time to let me know. It will feel full. It might feel a little tight, but we're going to try not to overpack it because that's going to continue to have discomfort. But what generally happens is we'll pack it pretty full. You'll feel the fullness, but you should not feel pain. Just very full. And actually what happens is your body absorbs, as the gauze absorbs the fluids, the serous fluids and any potential blood there may be, that'll start to lessen. You'll just basically, and then we'll talk about follow up here, but let me go ahead and get this started. Actually, before we get that in there, I do see a little bit of material. Thank goodness I hadn't gotten it totally started yet. Let's flush this out. Some sterile saline. Okay. Okay. I see a little more. Okay. Oh, it was just a little bit. Okay. Let me actually go in there and. Oh, okay. We just had a little bit of material. It's not too bad. Not too bad. Not too bad. Okay. Let's try again. I'll get this started with this. So it might feel a little cold. Okay. And actually what I find to work better is get a different stick. It's the end of this. I'll be as careful as I can not to touch the edges. Okay. Not too bad. I know it's a little full, but it's okay. Yeah. Got to get it in all the nooks and crannies here. Fantastic. Okay. Okay. Great. Great. Okay. Now, clean out any bit. Get any bit of leakage. Get it cleaned out around. Excellent. Okay. Now, do you have? I saw you were using a bandage. Did you have any other gauze or any other thing? Okay. Okay. Now this is our go-to. We love this. We love this. These are Tegaderm bandages. They're thinner, they're less irritating, they stick nicely. So fortunately they let us order some of these. Okay, so let me get this going. Okay, on there, covering everything, and I'm covering that little sore spot underneath so that it'll stay dry. Okay, and peel that off. Okay, okay. We are saying, so we'll see. The Dakins should kill any bacteria that's in there, so it's topical, and it's actually, preferred. I know how you don't like, you were saying you don't like to take antibiotics, so hopefully we can avoid that. Hopefully this will do the trick. Now, here's the thing. And the current state that it's in, this does need to be changed daily. Is there anybody that can help you with this? Oh, you do have somebody to come in home. Okay, great. Fantastic. Okay, but you do need some. Okay, you need some supplies. Well, we can give you a few of about 4 or 5 that we have. But you'll need Dakins. We can send a script on that one to your electronic to your pharmacy. What was your pharmacy again? Okay, we can send that electronically so they can get that ready for you. We can do that. The gauze, some of the other supplies that you saw me use. That'll get you through. We'll do that for a couple of days worth, and then we're going to put it in an order so that you actually have something that gets shipped to your home. Okay. And then what we're going to do is we're going to schedule follow-up appointment. That's gonna be for a week from today. Yeah. And just I'm gonna level with you. This is gonna probably take at least a few weeks. Yeah. Once it gets down to the point that it's mostly closed, we will declare you healed. You get to ring the little bell out front because I know you've been going through this for a while. Yeah, hopefully. But we're gonna make sure to take good care of you. And if you have any questions, yeah, they'll give you my card out front. Mm-hmm. Fantastic. Fantastic. Well, just when it comes to your diet, your exercise, just keep doing what you're doing. When it comes to showering, my best advice there is when you go to change the band, just go ahead and take it off. If some of the gauze falls out, then that's okay. Just shower. If you are able, just lay out for a while, let it get dry, or pat it dry gently with some extra gauze that we'll have sent to you. And then do the sterile repack. Mm-hmm. Okay, and we'll give you some materials also when we make an appointment so that your person will know what process we followed so they can follow the same process. Great, great. Now, okay, now I'll have the nurse come back in, take your blood pressure again, make sure everything's okay. Because when we have to poke around in there, we want to make sure your blood pressure's okay. Okay, but you feeling okay? That's what we like to hear. We'll get you patched up. Okay, I'll see you next week.